All right, we are going to go through the general preoperative instructions. It really doesn't differ that much among procedures. The postoperative instructions do. So I have a general postoperative instruction video as well as postoperative instructions specific to each procedure. So if you're having a surgery done, I want you to listen to my preoperative instructions, the general preoperative instructions, the general postoperative instructions, as well as the specific recovery or postoperative instructions for each procedure you had done. All right, so preoperative instructions. I'm going to kind of go through the points from our preoperative instruction form here. All right, big point in the preoperative instructions is nutrition. So what we want to do is make sure you are nutritionally optimized before surgery. That's super important because you can't heal without protein and vitamins. And a lot of people aren't very hungry after surgery. You're not going to eat the day of surgery if you're going to sleep. You can eat when you wake up, but you might not feel like it. So in other words, because people after surgery might not be very hungry and you need lots of protein and nutrients to heal after surgery, we really want you to eat a lot of protein and take a lot of vitamins before surgery to make sure you're all caught up and a little bit ahead of the curve before surgery. So what does good nutrition mean? Lots of fruits, vegetables, lots of protein. I like people to eat close to 100 grams of protein a day for a couple weeks before surgery and a month after surgery. That's a lot of protein. You're more than welcome to use protein supplements like protein powder. I like the unsweetened protein powder you get from Amazon. You can basically order anything as long as you're getting about 100 grams of protein a day. You should be fine. And get a protein powder or shake or supplement that you're actually gonna be able to eat or drink, not something that's so gross that you won't eat or drink it. Let's see, the protein stuff. Oh, one point on that, I find that the whey protein can be a little bit easier to digest for a lot of people. But you can use whatever protein supplement that you want to use. Let's see. The biggest thing you need to do before surgery is quit using any and all nicotine. That's patches, vaping, gum, cigarettes, cigars, chewing tobacco. Anything that has nicotine in it is bad because nicotine drops blood flow to your skin like nothing else. And so we need a lot of blood flow to your skin to heal your incisions, and a lot of the blood vessels to your skin get disrupted as part of the surgery. And so you really need to quit using any and all nicotine before surgery. That is super important. That is the number one thing that you need to do before any plastic surgery because it's all about making sure your skin heals, and nothing will ruin or delay skin healing or kill your skin like nicotine in your system at the time of plastic surgery or after plastic surgery. Also, don't take any weird herbs like St. John's wort or anything like that before surgery. Quit taking all that stuff a month before. If there's any weird herbs that you take that you want to keep taking, let us know so we can make sure it's okay. Otherwise, we're assuming that you gave us a complete list of all your prescription medications and over-the-counter medications, but sometimes the herbs get overlooked. So please just quit taking them, and if you need to take them, let us know what it is you're taking. But otherwise, I'd rather you just didn't take any herbs a month before your surgery. Activity, stay in shape. Keep your heart and lungs healthy before surgery because you probably won't be able to do that for at least a week after surgery or longer depending on what you're getting done. So, continue with your normal fitness routine and stay healthy. Avoid sun exposure. So really, really tan and sun-damaged skin heals more poorly. So try not to get super tan or sunburn before your surgery. Other things I want you to do before your surgery is just plan. So there's a lot of social, logistical things you need to figure out. Who's going to give you rides to and from surgery? Who's going to help take care of you after surgery? And whether or not you need somebody to take care of you, I'll go into depending on the surgery you're having done. Who's going to watch your kids or take care of other people that you normally take care of after surgery. Make sure your house is clean before surgery, do your grocery shopping before surgery, pay all your bills before surgery. Just do things that you can to make sure that you're ready to just focus on recovering and healing after surgery. If we ordered any preoperative tests like labs or x-rays, EKGs, things like that, make sure you get those done as soon as possible so that we can have them evaluated and address any concerns as soon as possible to avoid having your surgery delayed or canceled. So the sooner we have that information to act on, the more likely it is we can get things fixed up and taken care of before your date of surgery. Some things that you probably want to also do is when you go to the pharmacy, fill all your prescriptions. We're going to give you all of your prescriptions before surgery because I want you to be able to fill them and understand them before surgery. That way, after surgery, you don't have to worry about it. So fill your prescriptions while you're there. Get some Pericolace to help you poop. Get some Miralax and milk of magnesia in case you can't poop. Then at least you have it on hand. Get some Benadryl in case you have some itching. Get Tylenol because Tylenol is a great pain reliever with little and few side effects. Get some Advil or ibuprofen so you can start taking that a few days after surgery once I'm no longer worried about you bleeding. Motrin, Advil, ibuprofen, all the same things. If you're having anything done around your eyes or to your face, get some natural tears. It doesn't have to be anything fancy. Just get the daytime tear version, which is essentially saline, and the nighttime ointment version to keep your eyes moist. Some Gentle Dove body soap. And if you haven't already ordered it, protein powder. So I want you eating lots of protein before and after surgery. All right, things I want you to stop taking 1 week before surgery are things that make you bleed. Aspirin, ibuprofen, Aleve, naproxen, Motrin, BC powders, Goody powders, all those things, I need you to quit taking them 1 week before surgery because they will make you bleed. They make your platelets not stick together. If you are irregular with, I'm talking of pooping. All right, so if your bowel movements are already regular and you poop on a regular basis and it's not a big deal for you, don't change anything. Just take a stool softener after surgery while you're taking the pain medicine because pain medicine will make you constipated. If you're usually constipated and have weird, irregular bowel movements before surgery, I think it's a good idea to start taking a stool softener like Pericolace, a tablet in the morning and a tablet in the evening to help get yourself regular before surgery. The last thing I want is for you to start out constipated and then during surgery and after surgery you're getting medications that will make you more constipated. So let's start out not constipated and then we'll prevent constipation. So take some stool softeners, make sure you're regular before surgery. Because being constipated after surgery is no fun. And then you're not going to want to eat. You're not going to get the protein you need. Waxing and shaving. So I want you, if you're going to wax or shave anything, do it at least 2 days before. We don't like fresh waxing or shaving the day of surgery because actually your bacterial burden, the number of bacteria that live around the hair follicles that were freshly shaved or waxed is highest right away. So try and do all your shaving and waxing 2 days or earlier or further away from surgery. If your surgery is 48 hours or less away, don't do anything. We will shave you right before surgery. That way the bacteria don't have time to grow. So make sure you do any shaving and waxing at least 2 days before surgery. Otherwise, just let us do it. All right, 2 days before surgery, I want you to start showering with the chlorhexidine soap or the Hibiclens soap. Don't use it around your face, ears, mouth, eyes, or genitals. But everywhere else you can scrub your skin with the chlorhexidine soap. I don't know if it really helps all that much, but I basically do everything that I can to minimize your chance of infection. And chlorhexidine does a good job killing bacteria or decreasing the amount of bacteria on your skin, which are the bacteria that would be most likely to give you an infection. So why not, right? Even if it helps a little bit, it's worth it. So shower with the chlorhexidine soap, but like I said, keep it out of your eyes, mouth, ears, and genitals. Otherwise, scrub the rest of your skin with chlorhexidine. Try and decrease the amount of bacteria living on your skin. Don't use this soap after surgery. It's not good for healing incisions. Let's see. And then, morning of surgery, take a shower, or at least the night before. Shower night before, morning of, your choice, or both. And then wear really loose fitting clothes to surgery. Don't wear anything tight. Don't wear anything fancy. And darker colors are good in case you have any oozing that could stain lighter colored clothing. Also, the day before surgery, pack your bag. Make sure you have all your paperwork, any glasses, if you normally wear contacts, reading glasses. You need to bring your driver's license. Don't forget that. You have to have some of the identification with you at surgery. Some clean, warm socks, compression socks, if you have them. All your prescriptions, and anything else that you need. Your phone charger, bring a book. Sometimes you might have to wait a little bit depending on where we're doing surgery and what time your surgery's at. Something to keep your mind off the fact that you're having surgery is good. You can always keep rewatching all these videos to make sure you remember everything you're supposed to do. And an anesthesia provider should call you before surgery to go over some things and make sure you're ready. In general, just don't eat or drink anything 8 hours before your scheduled surgery time. Now, there are exceptions to this, and there are data that suggests that you can eat and drink closer to when you go to sleep, but not all anesthesia providers follow that. So it's safest and easiest, just don't eat or drink anything within 8 hours of when you're going to be going to sleep. Now, you can take your pills in the morning with a sip of water, but that's it. Gum is not good. Hard candy's not good. You can brush your teeth, but don't use any more water than you need to. And that's about it. Depending on the surgery you're having done, we may have given you medications to take beforehand, but I'm not going to go into that because I don't want to confuse anyone. So that sums up the general preoperative instructions that apply to every procedure that we do. I guess almost every procedure. I mean, if you're coming in to get Botox or something like that, you don't need to do all this. But any surgical procedure, this applies to. I hope you found this helpful. Please check out our website, restoreplasticsurgery.com. There you will find a price estimator that can estimate the cost of any combination of procedures that you might be interested in. You can also use our virtual consultation tool. It's essentially a way for you to send us your concerns along with photographs of your concerns, and we will respond with an assessment and our recommendations. On our blog page, there is a recording function called the Speak Pipe, and it's a place where you can leave audio recordings of your questions and things you would like discussed on a future episode. Finally, please follow us on Instagram and Facebook, and also check out our YouTube channel. Subscribe to the YouTube channel if you're watching this on YouTube right now. And lastly, we also have a podcast, Plastic Surgery Q&A, and you can subscribe to that podcast and listen to those episodes at iTunes or wherever you get your podcasts.